Did you know that what seems like a harmless act of intimacy could actually carry some surprising risks? Many people engage in dry humping or even try dry sex, thinking it's safer or more satisfying. But there's more to this than meets the eye. Whether you're just curious or considering it yourself, here's the lowdown on what's really happening when you skip the lube or leave on a layer of clothing, and why understanding these choices matters for both pleasure and safety. What's dry humping? Let's get clear. First, let's break down dry humping. In simple terms, it's all about rubbing, grinding, or thrusting against someone without direct penetration. It can be done fully clothed, partially clothed, or even with bare skin, depending on personal preference. It's a type of intercourse that many consider a safe way to enjoy intimate contact without the same risks associated with penetrative sex. But before we get too comfortable with the idea, here's the catch: while dry humping is generally safer, it's not risk-free. Some sexually transmitted infections, STIs, like herpes, human papillomavirus, HPV, and pubic lice, also known as crabs, can spread through skin-to-skin contact. And, although the chances are slim, there's also a minor risk of pregnancy if semen gets close enough to the vulva. So, what exactly is dry sex, dry intercourse? Dry intercourse, on the other hand, is about friction. It's the act of penetration without any kind of lubrication, which can increase friction to make the vagina feel tighter, sometimes thought to increase pleasure for the penis-having partner. However, people looking for this sensation might use materials or drying agents like chalk, sand, or even harsh chemicals, hoping to reduce natural lubrication. And while this might sound shocking, it's not just random. Cultural and social beliefs in some regions encourage vaginal dryness as a way to ensure pleasure, manage relationship dynamics, or avoid suspicion around faithfulness. In some communities across parts of Africa, Saudi Arabia, Costa Rica, and Haiti, women have reported using drying agents not only to enhance the feeling of tightness but also to treat STIs or as part of cultural practices. Some men even view natural lubrication as a sign of infidelity or illness, a view that's unfounded but can lead to some risky behaviors. Risks of dry humping versus dry intercourse. So, what's the deal with these risks? Let's break it down. Dry humping risks STI exposure because it's skin to skin. Some STIs like herpes, HPV, and pubic lice can still spread. Not to mention, it's worth being aware of any cuts or abrasions, which can increase risks. Pregnancy possibility, unlikely, but not impossible. If semen comes into contact with the vulva, there's a very slim chance of pregnancy. Dry intercourse risks vaginal health. Inserting any drying substance or skipping lubrication can disturb the natural pH balance. This opens the door to infections, bacterial, fungal, and beyond. Injury and infection. Unlubricated sex increases friction, which might cause tiny tears in the skin, giving infections an easy entry. That includes serious ones, like HIV. Long-term damage. Over time, excessive dryness can cause lasting damage to the vagina and lead to painful scarring. Not to mention, using caustic agents like bleach or detergent is just plain dangerous. These substances can burn and even cause chemical reactions, harming delicate tissues. Safer alternatives to dry intercourse. Feeling some hesitation? It's understandable, pleasure doesn't have to come with these risks. Here's what can make a difference. 1. Talk with your partner. Start by having an open conversation. Explain that natural lubrication is part of the body's way of protecting itself and making sex enjoyable. Suggest alternatives to achieve similar sensations without risking health, like specific positions that create a snug feeling, which is a safer, natural way to enhance tightness. 2. Use protection. Condoms and dental dams can offer protection, whether you're fully clothed or bare. They help create a barrier that reduces the risk of skin-to-skin infections. Plus, condoms provide the added benefit of reducing pregnancy risk if things go further than planned. 3. Keep lube on hand. Lubrication is not only comfortable, it's safer. If your body's not producing enough naturally, there are plenty of gentle, safe lubricants available that can keep things smooth and fun. This simple addition can prevent tears, reduce infection risks, and make the experience better for both partners. Addressing the bigger picture, consent and pressure. Now, there's something important to address here. Feeling the pressure to engage in dry intercourse or even pressured by a partner's preference for dryness is not okay. Your comfort and health come first. This should be a mutual decision, not one person's insistence. Being clear about your boundaries and standing by them can go a long way in building a relationship based on trust and respect. And if anyone tries to guilt you or keep pressing for dry intercourse despite your discomfort, it's time to reevaluate that relationship and even reach out to someone for support if you need it. Taking care of yourself post-dry intercourse. If you have already tried dry intercourse and experienced pain, irritation, or anything unusual, don't ignore it. Pain and irritation are signs that your body needs a break and perhaps some medical attention. If you notice symptoms like unusual discharge, a burning sensation, or anything else that doesn't feel right, seeing a doctor can help. They may suggest gentle products to help restore comfort and can provide guidance on STI prevention and vaginal health. Why knowing this matters? When it comes down to it, being informed helps you make choices that are best for you. There's no single right way to enjoy intimacy, but knowing the risks and taking steps to stay safe and comfortable can help you avoid unnecessary pain and health issues. Dry humping might be a low-risk, enjoyable option for many, while dry intercourse presents real risks that everyone should be aware of before diving in. The bottom line: whether it's dry humping, dry intercourse, or any other form of intimacy, you deserve to feel safe, respected, and comfortable. Natural lubrication, trust, and communication with your partner are all key to a healthy experience. And remember, there's no shame in choosing what's best for you or setting boundaries to protect your health. In a world full of pressure and conflicting messages, prioritize your well-being and make choices that keep both you and your partner safe.